Hi there, good to see you. Once again, Dr. Jennifer Hastings here with some information with regards to better health. Did you know that you can actually get cavities in your spine? Most people have no idea that cavities, meaning degeneration, is actually possible in your spine. No, they are not the typical cavity that you actually get because of bacteria eating away in your teeth, which actually that's a misconception too. It actually happens because your nutrition is so out of balance, you lose mineral in the teeth. But that's a whole other story we can talk about another day. Cavities in the spine is a different name of degeneration, right? For degeneration that happens in your spine. How do we get spinal degeneration? Spinal degeneration has various different names, such as degenerative disc disease or osteoarthritis. And when most people hear the word arthritis, they actually get confused and they actually do not really understand what's going on, unfortunately, because the word arthritis is used very openly out in the community. And I am the type of doctor that unless you come to me with a report that has been done after the doctors have done some imaging, when you come in and tell me that you were diagnosed with arthritis, I'm going to completely dismiss it unless you bring proper testing and show me how they can determine that diagnosis. What happens is arthritis means joint inflammation. So if you have a shoulder pain, you're gonna get diagnosed with arthritis or bursitis, right? If you have neck pain, you might be told randomly that you may have arthritis in your neck and they may tell you that it comes with age. But no, that's not so. Arthritis means inflammation in the joint, which also can express itself as pain. But you can actually have osteoarthritis, which is visible in x-rays, and that's what we're gonna talk about today. So what happens when you're actually in proper positioning in the spine and you're sitting, driving, jogging, going about your everyday life? Most of the stress gets carried in the back joints back here called the facet joints, and they actually get dispersed right here on the disc of the spine. When you actually have impact like a car accident where you get a little bit of whiplash, right? Or you're sleeping in the wrong position in your stomach and you start to twist and turn the spine in an improper position, then you start to create uneven pressure in the spine. And what happens with the spine, it causes wear and tear, hence resulting in osteoarthritis, that wear and tear in the bone. And so just to show you and give you an idea, this is a normal spine, normal disc, normal spacing, right, between the bones, because the disc is nice and thick, it's hydrated, this person is carrying proper stress throughout the spine. This is the center of the disc. This back here is the spinal cord. When you have whiplash, car accident, sleep in the wrong position, or like it happened with me, that when I was born, they pulled me by the neck and severely misaligned the neck, you get a condition called subluxation, meaning misalignment of the spine affecting the nerve. When you have a subluxation, little by little, it can cause wear and tear in the disc. So if we actually compare this one to this one, right, you can see the difference in the thickness of the disc. This one's a little bit narrower, this one's thicker. The center of the disc, known as the nucleus, starts to tear to the back a little bit, and then you can see that it's going towards the back. That's a bulging disc right here. This is the beginning of trouble in the spine. A lot of people can have bulging discs and not even know about it. Once that condition has been there for about 5 to 10 years, depending on your levels of stress, proper nutrition, even using of alcohol, it can determine how fast you go from a bulging disc into a full disc herniation. This is where the center of the disc has torn back completely. It's going back into the spinal cord, severely interfering with the energy that goes from the brain down the spinal cord and into all of the vital organs in your body. So right in here, you have a phase 2, meaning that this person has been subluxated for about 10 years. Phase 2 going into phase 3, where you see this bone, that's a spur. That's more wear and tear. And then you can also go from a bulging disc into a herniated disc. Not happy camper, not happy camper. This one is worse than this one. So we want to make sure that we check alignment. And once again, yes, you can have a herniated disc. Yes, you can have spinal degeneration known as osteoarthritis. And if it's multiple levels, they call it degenerative disc disease. And you can have it without feeling any pain. And unfortunately, especially you guys out there, guys wait and they ignore the pain and they wait and the pain goes away and then it comes back and it goes away. And by the time a man gets to my office, there's at least 2 levels of disc herniations that I usually find in 90% of the new patients that come in that are male. Then eventually what happens is there's so much degeneration that happens, right? And there's so much bone spurs that form, degeneration, until eventually the spine fuses together. That's a phase 3, phase 4. So we're gonna go back to normal. Advanced degeneration. You will be told by your orthopedist, by a medical doctor, or even a neurologist that this comes with age. And I can tell you that that is not so. I've had x-rays of a 70-year-old whose spine was perfect, beautiful, perfect curve in the neck, perfect positioning in the spine. And I've had 25-year-olds with beginning of osteoarthritis in their spine. And so trauma, nutrition, and not taking care of your spine will result in those things. Well, what happens when this happens? When you get decay in your spine, when you get the cavities in your spine, osteoarthritis, spinal degeneration, you sometimes don't even know it, but eventually it actually starts to affect other aspects of your health. It can give you pain, it can give you a lack of mental clarity, and sometimes the body even skips the process of pain and takes you directly into numbness or tingling, or even loss of strength in the nerves that are connected to that level that's degenerating. When I talk about loss of strength, it means that your legs might get more tired, your arms might get more fatigued, you might get arm pain, numbness, or tingling, or even leg pain, numbness, or tingling. And even beyond that, the most important part right over here is that we have, let me see if I could bring the camera up a little bit more. So we have the brain, right, that sends energy to every organ in your body, as you see right here, and it speaks to the body through the spinal cord. So if your body is misaligned and you're choking or pressing on those nerves that come out through the side of the spine right here, you're not just going to feel pain and discomfort, but your organs aren't going to work well. And believe it or not, most of the nerves in your body are not for pain signaling. Most of the nerves in your body are to talk to every cell, tissue, and organ so that you can actually express health. So do me a favor, make sure if you have not gotten checked, if you've never had your spine checked, but you have any sort of health issue going on, something as simple as fatigue, lack of mental clarity, or inability to sleep properly, make sure that you get checked. Or even if you feel good, then how about you feel even better and function better by making sure that all of the energy is going from the brain into every cell, tissue, and organ so you can express better health. Do me a favor, like this video, share this video, and comment, and let me know if you have any questions. Look forward to seeing you again soon for some more information on health and better tips to stay healthy.